I am Kay Thompson, Senior Program Officer with the Quality Assurance Unit, University of the West Indies, and I'm very pleased to be your moderator this evening. I'm joined by the very capable team led by Miss Dorothy Satchel, whom I will introduce to you in a few moments. We welcome as well all of our listeners and our viewers on YouTube and Facebook. We hope that you have an evening that is enlightening, an evening that supports your quest for better health and better understanding through the areas of research. I'd like to welcome as well all of our presenters who will be introduced to you individually just as they make their presentations, and provide you with an opportunity at the end of the process to ask some questions. We are here because of the enterprising spirit, the courage, the dedication, and the passion of one Dorothy Satchel. I have a brief introduction to read for Mrs. Satchel, and I'm going to do so, and she will also address you. Dorothy Satchel, a daughter of Westmoreland, is the founder and chairperson of MIstyBlue Cancer Care Foundation Limited, a Westmoreland-based cancer charity. She is a social entrepreneur with extensive experience in general management throughout her years of employment in education and criminal justice. She was trained at Church's Teachers College in Mandeville and began her professional career as a classroom teacher. Once a teacher, always a teacher. She's still teaching in this new context. She later attended Nova Southeastern University, where she completed a bachelor's degree in business and professional management. Ms. Satchel undertook postgraduate studies in criminal law, criminal justice studies, and international criminology in the United Kingdom. Her other areas of interest, where she has professional certifications, are educational research, mediation and conflict resolution, transitional management, drug and alcohol addiction testing and counseling, crisis management, and bereavement counseling. She is also trained and certified in Indian head massage. You note from this that she is well-rounded and therefore has a holistic approach to the interventions that she seeks to do in this area. She has a passion for helping others since her personal diagnosis and treatment for breast cancer, and she has become more of a social entrepreneur as a result, offering support and advice based on personal experience. She has been actively involved in various community groups and has done extensive volunteer work in AIDS hospice, alumni groups, where she held the position of president for 2 consecutive years, delinquent adolescent groups, adult literacy groups, and breast cancer awareness groups. It was these experiences of helping others that made her examine the cancer situation in Jamaica and Westmoreland in particular. This passion helped to serve her community. This passion, to serve her community led her to the formation of the MIstyBlue Cancer Care Foundation, a cancer care charity advocated for the most natural cancer treatment therapies. In her current position as founder chairman, Dorothy is responsible for providing strategic policy oversight and guidance in all aspects of the foundation's operations, securing the financial stability and reputation of the foundation, and ensuring efficient and effective implementation of board decisions. Finally, Dorothy, as the board chairperson, is responsible for human resource management and is also chief liaison officer with stakeholders and sponsoring bodies nationally and internationally. Dorothy is the #1 stakeholder for the MIstyBlue Cancer Care Foundation. For many of you, you know Dorothy as a force of nature. Dorothy, we take pleasure in welcoming you. We thank you for this work that you're doing, and we join with you gladly this evening to continue. I invite you to address our audience.
Hello, ladies and gentlemen. Good evening. It's that time of the month again. Thank you for joining us. MIstyBlue Cancer Care Foundation, as most of you may be aware, is a social, educational, and support voluntary group that operates out of Westmoreland. We have been in operation since March of 2015. Essentially what we do, we offer support in terms of through health fairs that we have mostly on a monthly basis prior to COVID for persons within the parish. We have an average of 7 health fairs each month, each year, sorry. And at those health fairs, we do screening for breast cancer, prostate cancer, cervical cancer. But because we have a holistic approach, we also do screening for high blood pressure, diabetes, HIV, syphilis, and some other tests. We also offer educational support and educational presentation from our doctors and other resource persons from within the parish. And we find that we have had very good results over the years. We have had very good support, very good collaboration from the Western Regional Health Authority, from Westmoreland Health Department, who are also collaborating with us on this occasion. And we cannot help but say a big thank you also to JIS, who have been a fantastic support for us. This evening, we'll be looking at prostate cancer and I'm sorry, we'll be looking at stomach cancer and lung cancer, and we have the presenters that the moderator will speak to you about later as we go on. So what we're basically going to be asking you to do is to hold your questions until the end. This evening we have a very qualified and competent moderator. Her name is Kay Thompson, and I will give you a little introduction to her. Immediately before joining the University of the West Indies in her current assignment, Kay Thompson was a teacher of English, social studies, and sociology, including sociology of health, then head of division at the Barbados Community College. Following a 12-year career focused on academic quality assurance and training of trainers. She collaborated with the Ministry of Health Barbados to produce the guiding policy and the first national training manuals and materials for food safety training and vector control training. Initially a graduate teacher, Kay's capstone master's research examined quality assurance in work integrated learning, internships, and apprenticeships. Recently, Dr. Thompson published a co-authored paper in Quality Education Forum on quality assurance issues in higher education internship and presented a paper on the preceptorship bridge in medical education, clinical education, and training at the 2017 Conquet Conference. Kay also has a chapter on continuous quality improvement in graduate employability. A Fulbright Scholar and graduate of the University of the West Indies and University of Albany, Kay is head of the Cayfield campus section of the Regional Quality Assurance Unit. She has one son and enjoys fishing and gardening in pursuing full life balance. So, Kay, we thank you very much for your role this evening, and we look forward to having a fantastic evening. Ladies and gentlemen, I hand back over to our capable moderator, and thank you very much.
Thank you very much, Dorothy, for your kind words and for the background on the foundation and its work. Our first presenter, we're going to go straight into the presentations. Remember, we're looking at lung cancer and stomach cancer. Our first presenter is Dr. Mong Ang, who is presenting on presentation of lung and stomach cancer incidence and mortality data for Westmoreland 2004 to 2018, and epidemiology of lung and stomach cancer and preventative strategies. By way of introduction, Dr. Ang is a naturalized Jamaican. He is a medical epidemiologist and head of the Epidemiology and Research Unit at the Westmoreland Health Authority, Montego Bay, Jamaica. A native of Burma, also known as Myanmar, Dr. Ang earned his MBBS degree from the Institute of Medicine, Myanmar in 1991, and a Master in Public Health from the University of the West Indies, Mona, Jamaica in 2001. Dr. Ang is a member of both local and international scientific organizations and professional organizations. Dr. Ang teaches epidemiology courses at local universities and is also a visiting professor at the University of Alabama in Birmingham, USA. He authored and co-authored scientific papers, abstracts, and posters, and presented at local and international conferences. Dr. Ng's research Interests include surveillance of both communicable and non-communicable diseases. Dr. Ung lives in Montego Bay, Jamaica, with his wife and two sons. Dr. Ung, a pleasure to welcome you to the microphone.
Thank you so much, Madam Chair. Good evening, everyone. I'm sharing my screen. See the screen?
Yes, we can see the screen, Dr.
Yes, okay.
All right,
thank you so much. Yeah, thank you so much for the for the organizers, and thank you so much for giving me this opportunity to present. So I'm going to be focusing on epidemiology of cancers. Two cancers in today's is focuses on lungs and stomach cancers. If I can move. Okay. So this is the outline of my presentation. As an epidemiology aspect of it, we're going to state some numbers and rates. We're going to start with global, Caribbean, national, and coming down to Westmoreland in terms of parish or focus. And we're going to be talking a little bit about risk factors. Human Development Index, otherwise called HDI. This is the indicator which is used to measure the population of a country in terms of their health status, their educational status, and also standard of living. So if a country score higher HDI, which means that the country has a lifespan is higher, the population of the country is lifespan, their lifespan is higher, the educational level is higher, and the gross national income or GNI per capita is also higher. How does that relate to the cancers? So looking at the HDI and leading causes of deaths globally, when you looked at it globally, cancer is the second leading cause of death globally. And when you also looked at the high HDI and very high HDI in countries, cancer is also a second leading cause of death. Where we stand in Jamaica, Jamaica is classified as high HDI. So it is established that in Jamaica, cancer is the second leading cause of death. In 2018, Globocon published global cancer statistics, and it is looking at incidence and mortality of the 36 cancer in 185 countries. What they found was in both sexes, lung, female breast, prostate, and colorectal cancers are the highest incidence of the cancers that seem most diagnosed in both sexes. For male population, lung cancer and prostate cancers are top two cancers being diagnosed, and for female, breast cancer is the leading in high incidence and high mortality in female population. In the Caribbean, this is the 2080 data, top 5 most frequent cancers in male population. It is I'm just going to focus it on lung and stomach. So lung is the second most frequent cancer diagnosed, and stomach is 4th in male population. For female population, you don't see stomach there, but lung cancer is the 3rd most frequent cancer diagnosed in female population in the Caribbean. For Jamaica, a similar pattern can be seen in male population. Second most frequent diagnosed lung cancer, and 4th is stomach cancer. For female group, the difference from the Caribbean is we do not see lung cancer in female in the top 5, but stomach is top 5 most frequent cancers in female population. Now, globally, this is looking at the lung cancer's death, and the age-adjusted death rate for lung cancer in Jamaica is 15.26 per 100,000 population, and Jamaica ranked number 80 lung cancer globally. In the country, lung cancer ranked number 10 in the cause of death in the country. Looking at the stomach cancer, again, age-adjusted death rate for stomach cancer in Jamaica is 7.86 per 100,000 population, and Jamaica ranked number 66 in the world or globally in terms of stomach cancer rank. For in the country, stomach cancer ranked 19, leading cause of deaths in Jamaica among cancers. So this slide is just to compare and see is there any difference in terms of top 5 cancer sites in the Caribbean and in Jamaica. In female population, when you look at for the stomach is number 5 in Jamaica, but we don't see that in Caribbean population, Caribbean data. But for the lung cancers in Caribbean is ranked 3rd. For male population, all both cancer, stomach and lung cancer can be seen in both top 5. This is a study done in the largest parish in Jamaica, Kingston and KSA, Kingston and St. Andrew. There's a study done over almost 50 years. And in female population, we don't see lung and stomach cancer in the top 5, but for male group, you see in top 5 both lung and stomach cancer, especially lung cancer is the second, comes second in male population. WHO data, which also show that lung cancer and stomach cancer, lung cancer ranked number 4th and stomach cancer ranked 6th. But when it comes to mortality, lung cancer ranked 2nd, followed prostate cancer is 1st and followed by lung cancer 2nd in terms of mortality rate. Now, looking at the western region, which consists of 4 parishes, Westmoreland, Trelawney, St. James, and Hanover, and we looked at the number of patients coming to our facility, which is a type 8 hospitals, where cancer therapy is offered, and looking at from 2008 to 2011, and lung and stomach cancer is seen in the male population, and you don't see that in female population for those 2 particular cancers. So it can be safely said that these lung and stomach cancers are mainly cancer of men. I put Corey in front of it. Evidence also and data suggests that these lung and stomach cancers are top 5 cancer in Jamaica. Now looking at Westmoreland, parish of Westmoreland, where our focus is going to be on today. Parish of Westmoreland has a total population of a little over 145,000. It ranked 8th in terms of population, and first is being the St. Andrew, and the 40th, the lowest one is the Hanover. Female to male population is 1:1. In terms of economic activities, farming, they do farming as well as tourism is also thrive in that particular parish. And we all remember and we all know Nigre is one of the top tourist attraction city in the Caribbean. Looking at top 6 cancer deaths in Westmoreland from 2016 to 2018, female group, stomach ranked out of 5, so it's at one point in 2016 it ranked 4, and 2017 and 2018 it ranked 6. For lung cancer and bronchus and lung cancers, for female population, it's ranked among top 5. For male population, all 3 years, you can see both cancers stay within top 5 cancer deaths, particularly in Westmoreland. Now looking at top 6 leading cancer deaths in Westmoreland, and the red bold line is representing the lung cancers, and the green line representing the stomach cancer.
Dr. Ang, Dr.
Yes.
Ang, I'm sorry to interrupt you. I'm not sure if you're turning your head in 2 different directions, but there are times when we're not picking up some of what you're saying. So I don't know if there's anything you can do about it, but to just be conscious if you could be as close as you can to the microphone. Thank you. Sorry to interrupt.
No problem. Apologize for that. I'm going to talk a little closer to your computer. Can you hear me better?
Yes, we hear you well there.
Okay, very good. So this is the figure that we're looking at, the top 6 leading cancer deaths in Westmoreland. So the red bold line represents cancer of lungs, and the green bold line represents cancer of stomach. Even though it is not in the top, but at 1 or 2 years, the cancer deaths due to lungs superseded the cancer of prostate at 1 to 2 years point. However, when you look at the cancer deaths due to stomach, you don't see much significant change throughout the years from 2004 to 2018. So this is look at only 2 cancers. For cancer of lung, even though you can see spike in some years, and you can safely say that in 2018, we have seen increased number of deaths due to lung cancer. And for stomach cancers, similarly, there were some spikes in some years, but the numbers still remain the same, and there is no significant decrease or increase observed in stomach cancer in Westmoreland. This is very populated chart, but I just want you to focus on the red bold line. So this is the death rate, 100,000 per population. So try to compare with the remaining 13 parishes. So at some point in 2013 and 2014, the deaths due to lung cancers in Westmoreland was higher than all remaining 13 parishes. So that's the point that I'm trying to make in this graph. For stomach cancer, earlier in years 2008 or 2009, somewhere right there, the stomach cancer, deaths due to stomach cancer in Westmoreland was higher than the remaining 13 parishes. So looking at the risk factors, these are the modifiable risk factors. I'm not going to go into detail to those. Obesity, physical activity, and dietary practices, tobacco use, and harmful use of alcohol. Those are there's a link between cancers and these modifiable risk factors. Looking at Westmoreland in terms of one of the modifiable risk factors, obesity. So when you look at the total in terms of the rank in obesity in the parish, compared to among 14 parishes, Westmoreland ranked 3rd. And when we look at male population, Westmoreland is ranked 2nd. And for female population, Westmoreland ranked 8th. So male population, please focus on male population. Male population is, we are looking at lung and stomach cancers and male population, and we are seeing obese male, particularly in Westmoreland. This is one of the modifiable risk factors that we have to be working on to reduce the cancer in this group. For lung cancer, for risk factors, the number 1 risk factor for developing lung cancer is smoking, and particularly tobacco smoke. And there are others as it relates to the risk factors. Anything to do with lungs disease, chronic obstructive pulmonary disease or COPD, exposure to certain pollutants, and operating within poorly ventilated conditions. For example, indoor cooking fumes, exposed to asbestos as is a known risk factors for cancers, and exposed to silica dust from during the mining or breaking up stones. Those are the other risk factors. But the number 1 risk factors for lung cancer is smoking. For stomach cancer, who are the high risk of having stomach cancer? As we said that previously, men are considered to have a higher risk, even though it can happen to both genders. Stomach cancer usually happens in 70s. It can also happen as early as 30s and 80s years age group. It's most common age group that we have identified in being 60s. For risk factors for stomach cancer, smoking, again, diet low in fruits and vegetables, and family history of gastric cancer. So that's one of the things that we also need to take a note. Infection with a stomach bacteria called Helicobacter pylori, and also long-term stomach inflammation. Persons with polyps, history of polyps, stomach polyps, that's also a risk factors for stomach cancers. And a condition called pernicious anemia is a risk factor for developing stomach cancer. So looking at the country of prevalence of smoking, this is the study done in 2000, Global Youth Tobacco Survey, that identified they did the study on 13 to 15 year age group, school children. What they found was initiation to before age 10, 35.3%. That's very high. At the time of administering questionnaire, we have identified 33.8%, almost 32% ever smoked. 13 to 50-year age group. And the current prevalence, the currently person who was smoking is 15.2%. That's also high. The prevalence use of tobacco product is not only cigarette, other product are 19%. And very importantly, susceptibility of never smokers to initiate smoking is 15%. That is also very high. There is also a study done in 2016 and 17. There's a national study, Jamaican Health and Lifestyle Study or survey that identifying 41% of 15-year and older use alcohol and 15% of 15 years or older use the tobacco product that's current use, and 17% of Jamaican use marijuana. So those are the risk factors that can develop both lungs and stomach cancers. Looking at Westmoreland, this is the study done by Rapid Assessment and Response by the National Council of Drug Abuse in 2010. 34% have ever used cigarettes in Westmoreland. 8% currently smoking, and 37% have ever used ganja, and 60% currently use. So that's very high